if you would, please give a warm STEM welcome to Dr. John Adler.
Thank you. All right, thank you guys. This is great. I think a STEM society or a club at TMCC is long overdue. So it's really nice to see you guys, and I hope that, where's Kaylee? There she is. And I hope you get that PR out there, because we need more of our students to go to things like this. This is where you actually get a lot of the learning done, rather than me going through a lecture and then giving you a test, but there will be one. So, no, I'm just teasing. So I'm Dr. Adlish, and I'm a professor of biology in the biology department here, but I also spend a lot of my time when I'm not here in the Amazon basin in Peru, in northern Peru. And what I do there is to work in tropical medicine and infectious disease. And we do a lot of things there that we're going to talk about. So what I'm going to do today is to take you down there visually to the Amazon basin, show you kind of what the Amazon River looks like, and then we're going to start talking about certain diseases. I'm going to focus on 3 or 4 diseases that are prominent in the tropical regions, especially in Peru. And then I'll show you some other things that we have, and then, just a whole bunch of stuff. So, if you're ready to go, let's go. Yeah. Anybody know what this is? Can I get the lights down a little bit, or is there, will this one? Oh, you don't mind, do you? Can you see me? Do you want to see me?
Not at all, but that's all right.
Okay. Or maybe, well, that gets you. Well, I'll turn them off when I need them. Okay, this is a capybara, largest rodent in the world. And they have hair that's like bristles. Where is Peru? South America. Peru is in the west coast, right up there in sort of brownish. And where we work in Peru is right here. I don't have a laser pointer. Eddie, you don't have one, do you? Yeah, if you could, that'd be great. So if you look up here, over to the right there, you see where Iquitos is in the northeast corner up there. And then the Amazon River runs right through Peru. And we spend a lot of time in Iquitos. Iquitos is a really cool city because it's a tropical city. And I'm going to take you there and show you some pictures. But it's really an island, because there are 3 rivers that come together that merge to form the Amazon River. And we are at a place where the Amazon River begins, and you're kind of, isolated. There are about 600,000 people there. But if you look at the kinds of diseases that we typically see in Peru, this is what you get. 3 that we call the 3 fevers: malaria, dengue fever, and leptospirosis. And if you're not a biologist, this is actually a pretty good introduction into microbiology, because malaria is caused by a protozoan. Dengue fever is caused by a series, what we call 4 serotypes of a virus. And leptospirosis is caused by a bacterium. So it's kind of a broad spectrum of disease. Other diseases that are common in Peru that I deal a lot with are tuberculosis, leishmania, and ascariasis. So one bacterium, another protozoan, leishmania, and ascariasis is an infection caused by a parasitic worm. But we also see, and I spend time in 3 different hospitals and in lots of pueblos up and down the Amazon River where we do clinics. But we see these things all the time. You see these in the US, but you see those in Peru as well. HIV, AIDS, bacterial pneumonia, viral pneumonia, hepatitis, the sort of run-of-the-mill infectious disease things that you might see anywhere. But what's different for us are the things that you see in the tropics, which are probably more interesting biologically as well. So this is Iquitos. This is the oldest building, believe it or not. Iquitos was founded in 1850. So it's not a really old city. It was a rubber plantation, and it's been since converted into a city where they have various industries. This is the church, which is the oldest building. This is what we call the Plaza de Armas, which every South American city has. It's kind of the main center square, and this is just one piece of it. But you get the feeling for what it looks like, to be in a tropical city. Everybody gets around in moto taxis. there are probably 90% moto taxis and motorcycles versus 10% cars, maybe not even that, maybe 2%. Driving in Iquitos is a challenge, and I've driven motorcycles and cars and, you know. What's that?
Motor taxis?
I haven't driven those, but I drive sometimes. It's scary because, but you know, it looks like it's organized chaos, but it works. And everybody knows, oh, thanks. Everybody knows that you have to pay attention. You just have to get used to the rules. So, all right, so Eddie, is this going to work for?
Give it a chance to
Does it have to find it? So this is, again, you know, traffic, typical street. This is how you park. And you can see it's a pretty dense city. There are 600,000 people in this little island. This is the river walk. There's a couple of museums, lots of shops, a lot of nighttime activity. But I'm kind of setting up to show you a few things. This is walking along another river that's not the Amazon. The Amazon would be over a set of hills there. You know, people bring everything in their moto taxis to home. You'll see people, 6 soles. You can buy all these bananas for $2. Great. So, yeah. So this is the Amazon River. And where we are is really just kind of going into the beginning of the Amazon. It's hard to, you know, these things are hard to catch on photos. So I have a series of photos to show you. And by the way, all these pictures, I've been working in Peru for 8 years, but I lived there as a youth and I've been back and forth. And so I've been working in Iquitos for 8 years. So a lot of these photos you're going to see are from different, you know, time frames. This is a good one because where these guys have pulled in, this is a floating gas station. You don't see too many of those on the truckee. So here we are, and my guide, Jose, was saying, well, and I'm in the front of the boat. You can just see the tip of our boat here. We have a big fast boat. And I hear sputtering. And we're like 2 hours from Iquitos. We had been up the river about 5 hours. And we're 2 hours away from Iquitos, which is probably 40 or 50 miles. And at this point in the Amazon, it's 14 miles wide. And so I hear the sputtering, and I keep looking back at Jose. So what? That's not normal. He goes, no, 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 it's okay, it's okay. You know, and then finally it dies, and I go, I know that's not normal. You know, what's going on with the engine? He goes, oh, no, no, it's okay, it's okay. We're just out of gas. Like, we're out of gas in the Amazon, right? And he goes, no, no, but you know what? It's okay. We'll just cruise, and then I think there's a floating gas station around the corner somewhere. You think there's I have to catch a flight at 10 o'clock at night. No, you'll get there. It'll be fine. Yeah. So we float into the gas station, and you know they gas up, and you know it's actually a great lifestyle. But sometimes things are a little slower. So here you are looking. If you look at these trees across here, we are quite a ways away. Those trees are 200 feet high. So you're talking about, you know, we are somewhere between 5 and 6 miles out there. And you see these clouds that arise off the Amazon. It's actually really beautiful. It's one of the most beautiful places I've been to. Coming home at night, this is kind of what Iquitos looks like. Coming into one of the ports that we leave from. You know, big river and very deep, and little creatures that have teeth and things like that. So one of the things we usually do is go fishing for piranha. And I tell people, and one of my good friends fishes, he's sitting right here, Dr. Burke, and I keep telling him, you have to go where there's real fish, you know, where I can push you in, but he's really skinny, they wouldn't eat him. And, you know, but the piranha, they're all over the place. They don't really eat you. We can go swimming in the Amazon, and they'll just taste you a little bit and then leave you alone. But there's lots of things there. Dolphins, bull sharks. Last time I was there in January, 2 of my friends pulled out a freshwater ray that was 14 feet across. And because the Amazon River is huge, it's miles wide and it's hundreds of feet deep. So that's kind of a trip down the river. You go to the marketplace. This is part of Iquitos. And the reason I have this is because they have so many herbs and spices and natural medicines, and we deal with this all the time. There is Western medicine and there is traditional medicine that you see. And the two actually, cohabitate fairly well. And you go through the marketplace and you see all these different kinds of things. These right here are seeds from a tree. They're huge, and they will make bowls out of them. So this is what it looks like going through the marketplace. And the reason I'm taking you here is because I teach microbiology, and we focus on transmission of disease. And if you haven't been to these places and you go, oh my goodness, you can look at all the different possibilities of transmission of disease. So here you have a lady, making bananas with the fish down there. But just try to picture this as being about 100 degrees with well over 90% humidity. And you're walking through here, and there's rain and there's dogs all over. And if you want to get yourself some fried banana, maduro, with turtle, these are turtle eggs here, you could do that. And these are the fruits, which I think are pretty interesting. These come right out of the jungle, but I think you get the picture a little more when the lights are off. Let me try to find this. So if you look over here, you know what these are. Those are pineapples, right? Bananas. Peru has 7 different varieties of bananas. And this, I don't know if you might recognize that.
Watermelon?
That's a papaya. And you see the ones at Rayleigh's here, And my wife goes, oh, let's get some papaya. No, I want papaya. I want those. And then you go over here, and you will see these are different kinds of fruits and things, but you'll see stuff, everything is big. And I'll show you some pictures. Because everything grows year-round, great soil, lots of oxygen, lots of water. And these are, even the snails, you see those shells over there? Those are snails that crawl along the floor of the jungle, and they are about that big. So, everything there is pretty big. Now, we're going to go down to Balin, which is a poor part of Iquitos, and we're going to look at transmission of disease, and you'll get to see how part of Iquitos, and I'm taking you to the poor section, so 600,000 people, there's about 200,000 that live in this area, which is the poor section. And if you look at this ridge right over here, those trees, that's where the Amazon River is, okay? We're going to go into a part right over here that is a branch of the Amazon called the Itari River, which is still 10 times as big as the Truckee, and kind of show you what it looks like when both of these rivers come up. So this is a dry season. We only have 2 seasons, hot and not quite as hot, or what we call rainy and not quite as rainy. And so this would be the, quote, dry season. You see the houses are all up on stilts here because the water's going to come up. And this is kind of how you transmit disease. No sanitation, no running water. People are just dumping everything there. The river has gone down in this case, still dry season, but then it comes up. So take a look at that. And now you're going to get to school. This would be kind of cool if you're a kid. You're going to go to school in a canoe. You're going to go to church or the market or whatever in your canoe. Pull up there. You can see the steps here to one of the little churches there. And you just kind of cruise in there and then do your thing. But there are some other problems. So when you look at this river, this part of the river is coming up, and you see these kids are bathing here. And actually, just a few days later when I was here, that we went from here to here in about 3 days. So it's not like, Reno gets a rainstorm. Iquitos, 2 years ago in 6 months, had 108 inches of rain in 6 months. And the Amazon River came up 180 vertical feet. So it came up from where I showed you over the ridge all the way to flood half of the city. So imagine 180 feet vertical, how far out is that? Miles and miles and miles. So it did, this is my summer home. No, I'm just teasing. Dry season, wet season. It got so bad that you see this house starting to actually lean over. And what's interesting is that they will raise these houses as the river rises. They dive underneath the water and they loosen the ropes, and then the house floats up and floats up. When it gets to the point where the river's too high and there's no more rope, you either lose the house or you untie it and you float out to the Amazon, and wherever you end up, that's where you end up.
The house floats on the river?
Yeah. Yeah, these houses are all made out of balsa. So how do we transmit the disease? Well, you know, when you look at this, you can see in a picture like this, there are a lot of things going on. This water is unfiltered. It is, everybody is going to wash their clothes, their dishes. A little vulture here while you're washing your dishes. This is an example. This is an outhouse. So the outhouse, you know, these kids are bathing and washing next to the outhouse. So that's how you transmit disease. There's no, you know, there's no sterile water. There's no sanitation. This is a little stream running into the river. These are all outhouses where people will go do their business, and then all that water flows out into the river. Here's a floating house in the river. These guys are out swimming, you know. It's like, oh, kids, go out and play in the front yard. Oh, wait a minute. No, you go out and swim in the front of the house. So they're doing all their thing, and just imagine the kinds of things that could be in this water. And just to give you an example of how they live, this is a floating house, and they have their pig here. It's a pig lying in the house, which was slaughtered a couple of days later, and that would be their food supply for a while. You know, so when you transmit diseases, a lot of these individuals that we treat will live in symbiotic relationships with lots of different things, but sometimes they get sick because more than 2 infections will put them over the edge immunologically, and then they have to come in for treatment. But in this case, you can see this lady is selling armadillos. And in Peru, there are just 2 armadillos. There's regular and extra large. And so these are some of the giant armadillos, big long tail. And you could buy a foot or an arm or whatever you need. And she's going to give you change back right here. So it's very hot, very humid. Things are sitting out. And if you don't like armadillos, just grab yourself a monkey paw. So a monkey arm, I think that's like 5 soles for a monkey arm. Because they eat everything, okay? It's not that they're bad people, that's what they do. So this I took in January, and this is back in the market. But you see the fish, all the fish have been pulled out here. Here are some lemons. This is charapitas, which are one of the hottest peppers. Actually, they have the highest concentration of capsaicin peppers. They're little tiny ones. More fish here. Wet, good source of transmission for disease. Does that make sense? So that's one way. So what do we do? You know, what do we do in the hospital? This is a manatee from the manatee rescue, because manatees are endangered, and the Amazon has, or used to have, a lot of manatees, and people, you know, kill them because they want to eat them as well. And this, we're kind of back to the marketplace. I don't know if this is going to work. Eddie, this is a video. Will this work for me? Over here? Where's the play button? Right here? Right there. Laser pointer, highlighter. No, it's not going to work. Well, I had a video of, you'll see these later in the marketplace, worms that people fry and eat. They're really thick. So this is a monkey. This is at a monkey reserve, endangered monkey, but he wants to go check out what we do in the hospitals with you too. And this is one of the main hospitals that I spend time in, which is what we call hospital apoyo, which means the support of the people. Peru has socialized medicine, which has now been fully implemented only a couple of years ago. This is a really good friend of mine, Percy Inga, and I'll be seeing him again in August. He's the chief of surgery at another hospital called Es Salud, which is It's Your Health. And unfortunately, I bring him gifts from the United States. I am an avid Steelers fan because my family's from Pittsburgh. And Percy says, oh, can you bring me a Patriots cap? What? And I have to put it in my suitcase and hope that it doesn't melt through the suitcase. And so he gets T-shirts and things from the Patriots. He loves American football. You know, we have students that go to classes. This is Dr. Luis Celis. I take students, and I don't do surgery. I translate in surgery for them. And they go, you know, they learn how to read X-rays. They learn how to do palpitations. Excuse me. This is a kid, or man, he's 40 years old, that had liver cancer and tuberculosis at the same time. And so you'll see these things, like this is Moisés Siwincha, a good friend of mine, who actually trained me in clinical infectious disease. looking at an x-ray of a patient with tuberculosis. And students learn to read CT scans. And I bring these things into my class in microbiology here. And they're, if you know what you're looking for, they're really not that hard. But you can see these little white areas right here. These are this is scar tissue from an individual that had encephalitis, healed over from that, and then still has the residual effects of those. This is one of the infectious disease staffs. This is another example of what we see. This is hepatocellular carcinoma that's the result of hepatitis B infection 10 years later. And you're looking down, this is a cross-section, you're looking down into all the organs of the body. And what you're seeing here, this is the spine, this is the vertebra right here, these are the ribs. So this is your belly, this is your back, this is your liver. And this black right here, you see this growth inside here and all of this. This is a tumor. So that's liver cancer. And this young man was 26 years old. And unfortunately, it has metastasized over here and a little bit in there as well. So this was the result of infectious disease, hepatitis B, that 10 years later resulted in liver cancer. Same thing here. Now this is a guy who had liver cancer and tuberculosis. Students are learning how to palpate him. Again, CTs, this was a problem with prescriptions where the prescriptions were off and the woman had neurological damage, and you can see that on the CT scan. This is Moisés Siwincha and a couple of nurses in the infectious disease unit. Pediatrics, we send kids through pediatrics. This is a good friend of mine, Luis Celis, and this is a premature baby. And he just, does this, and he came up to me once and goes, here, no, I'm not gonna, I don't want to drop him. So he does that because that's what he does for a living. A good friend of mine, Moisés Siwincha. So you get kind of a flavor of what goes on in the hospitals. This is an ER visit. Another friend of mine, Roberto Lazo, who's a very good ER doc. And last time I was there in January, I had a bunch of students, and one of the students spoke Spanish, so she went to translate with Roberto Lazo. And he was trying to say CT scan in English, which would be CAT scan. And so she was, she didn't know how to translate that in Spanish. She goes, CAT scan. He goes, cat. And so he starts going, gato? Like, rawr, rawr. Why would you call that a gato scan? And she's going, no, not cats. So they had an interesting interaction, but he finally figured it out. And we take people to the labs, and they do things. So this is where we can begin. This is, under the microscope, which is what Norberto was just looking at, an egg of a parasitic worm that is referred to as Ascaris right here. This is the egg. There's another one over here. There's one over here. This is actually something else. So this person was dually infected with 2 different organisms. And you see those right in the laboratory as the individual sitting down the hall and you're trying to diagnose what they have. This is an interesting case because this is, and I don't know, and neither does Norberto, we don't know what this is, but some sort of large insect bit a man and laid eggs in there, and then the eggs turn into larvae. But I use this as innovation. And your students, you're all going into different things where you may have to be innovative. And my friend Norberto, they couldn't get this worm out because every time they would try to go in, the worm would go down. And so he had stopped smoking. And then said, because he was raised in the jungle, he says, hey, there's this legend that if you blow tobacco or smoke in there, it'll irritate the worms. So he covers the guy's arm with saran wrap and smokes, and then breathes the smoke into his hands and builds up a concentration of nicotine, and then applies it over the wound. And sure enough, the worm came out, pulled it out, and it was actually fairly large. There were 2 of them that came out, and then they sewed him up. I'm not advocating that you learn how to smoke, but you can see where different things can help people medicinally. This is a sloth. 3-toed sloth is a baby. And so we go out and do clinics in the jungle. This is a group that we just came back with after we did a clinic. So I'm going to talk about parasitic worms real quick. And the first one is Ascaris. This is what it looks like in the small intestine of an animal. So it's going to grow in there, and it's going to begin to divide. These are the eggs, and I showed you those before. Let me see if this is going to work. No. This is one that has been taken out of an individual. But here are two examples of what you see a lot of with Ascaris. This is a man who we had given antihelminthic drugs to. Didn't respond very well. He's smiling, not because he's happy to be lying down in the hospital bed, but because Percy Inga, my friend that I just showed you before, the surgeon, is going to cut right here and then take out the worms, which he does in surgery. If you really want to have fun, be in surgery when you take all the worms out. You pull them out by the handful and just kind of toss them on the floor. This is a little kid that came to us in a jungle clinic, and you can see he's got some issues right here. And that's because he's got a belly full of worms, really sick. But we gave him medication, a day later he's out playing soccer. This is a kid that came into us at another clinic. We were way up the river and started a clinic at 7 in the morning. This day I remember because the really, really hot days I remember, this was about 110 in the jungle with 100% humidity. So you're just looking through the mist. And she brings him in, big belly, very sick, almost comatose, totally dehydrated because he's got a belly full of worms, doesn't want to eat anything, and he's going to expire on us if we don't take action. So, you know, I mean, the pictures kind of show you what he's going through and what his mom's going through. Then here's Percy, and we examine him and say, yeah, he's got, you know, Ascaris. Let's put him on IVs to rehydrate him, give him some antihelminthic drugs. And if you look at his belly here, you see how distended he was here. He's smaller here. And then this is one of our students who's, you know, you don't have an IV hook. He's holding the IV. You see how sweaty he is? I mean, this poor kid was really suffering. But you see how his belly's gone way down? This was after about 8 hours of treatment. The drugs that we use for these worms irritates their nervous system, their calcium pumps, and causes them to come out. So the reason his belly's a lot smaller is because he's been vomiting worms all over the floor. But it's better to do that than it is to continue. He probably would have died in a few hours because he was so dehydrated. And we just happened to get there. The 3 fevers. Let's talk about malaria. This is a protozoan infection. There are actually 5 species of Plasmodium that cause malaria that are known now. In Peru, I deal with falciparum, vivax, and ovale. And these are mosquito-borne. And the mosquito is the Anopheles mosquito. And it is only female mosquitoes that bite and inject blood. Male mosquitoes are just good for one thing and then they're tossed aside, right guys? So, you know what I'm talking about. She's got to give a blood meal to the larvae that are developing. So female mosquitoes will bite. As far as malaria goes, this is what it looks like worldwide. It's in the tropical regions all over the world. And that's where most of the population on this planet lives. So it's a problem. Malaria is typically associated with infecting the liver, but it affects all the organs. And if you're not experienced in treating malaria, you have to realize that it can hit the brain, it can hit the intestines, it can hit lots of different things. This is a lady that had cerebral malaria. She did not survive. Malaria can hit the brain, and this is falciparum, and cause you massive problems, and there's nothing you can do. It's going to go quick, and it kills. Last year, there were 665,000 deaths worldwide, but millions of cases of malaria throughout the world. If you look at this under the microscope, it is a protozoan, and right here is the zygote, which is a fertilized egg. This is very characteristic of just falciparum, Plasmodium falciparum. You don't have to be a biologist to appreciate this, but this right here is the easy diagnostic you can get, because this banana, what we call the banana zygote, is indicative that that's Plasmodium falciparum. This is from one of our patients that's sitting out there. You know, we're waiting to admit her in the hospital. And this is the most aggressive. This is the one that kills most people. This is another form of malaria. This is Plasmodium vivax. You see these circles right here? These are all the protozoan. All of these are red blood cells, and they're kind of clumped together because that's what malaria parasite in this particular species does, is to clump those red blood cells together, thus lowering your defenses, your ability to fight off the infection. This is another one. This is Plasmodium vivax, where these red blood cells have burst and released what we call merozoites, sort of like little spores. This is why it's a big problem. And then they're going to spread into other red blood cells. They're going to go to the liver and do those kinds of things. Malaria hits everybody. This is a pregnant woman. That's a harder case to treat. We can't use traditional anti-malarial drugs on pregnant women. Small children. Small children again. But you see, you can look at her. She had Plasmodium vivax. She is supposed to be brown. What does she look like to you? Kind of yellow, right? Jaundiced. She's yellow, liver malfunction. Her eyes, the conjunctiva in her eyes are yellow. So malaria is really prominent, and we treat it with anti-malarial drugs. That's a protozoan. Leptospirosis is another fever that's caused by a bacterium called Leptospira. This is an electron micrograph of Leptospira. It is a spirochete. This is transmitted through contact with animal urine, feces. We have this in the United States. It's just not as prevalent as it is in the place that I just took you through all of the water. When you have Reno, Nevada, by the way, is a very sterile place to live. And I tell my students that take micro, I go, you know, if you want to be an infectious disease doctor and work in Reno, it's pretty boring because there's not a lot here, you know. You get an occasional spider bite, and you know, you might get, a friend of mine was an ER doc for 20 years, was practicing medicine, called me up and he goes, I just had my first case of malaria. I go, really? I go, how'd you diagnose it? And silence. Well, I don't know, but it was, do you know which species it is? Well, we're working on that, you know, which these guys do this all the time, thousands of them a day, so they can do it. They have techniques that we don't use here where you can diagnose a species in an hour. Leptospirosis, this is one example of what can happen with leptospirosis, is to cause hemorrhaging. And this is an individual hemorrhaging from the eyes because this causes a massive fever, and it will cause your capillary beds to start to break, and you can hemorrhage. The other thing that it causes is encephalitis. And this is an individual who had leptospirosis. He is comatose, and he does not react to anything. His eyes are fixed. His pupils are dilated. He is on intravenous antibiotics. We took him off of the antibiotics and thought that he was going to die, and 6 days later, he wakes up. And he eventually worked his way back to being able to walk, feed himself. But he was bitten by a rat. He was cleaning out his house. He was bitten by a rat and ended up, he was in the hospital for a couple of months. And then he still has permanent damage, but he survived. Dengue fever is a virus. This is spread by a different kind of mosquito. Malaria mosquitoes are anopheles. They come out at night, and dengue mosquitoes, dengue is transmitted by Aedes aegypti, which comes out during the daytime. So and the fevers in the first few days are almost identical. One of the ways that you can kind of get a handle on it early is to find out when were you bitten, and it's not just one mosquito bite, you have to be bitten a lot. You know, when were you bitten by these mosquitoes? Well, it was in the daytime. Okay, I think we can work with that. So there are 4 serotypes, which means essentially there are 4 different strains of the virus that we deal with. And one of the things that dengue causes is, in a little bit less than 1% of the patients, dengue hemorrhagic fever, where you burst, the virus causes a reaction where you burst all of your capillary beds and you bleed everywhere. So over your whole body. These are 2 individuals in January, this January, that I took pictures of. And this guy over here is starting to recover. He was purple from head to toe because he's bleeding everywhere, painful, and you can't give them too many drugs because a lot of anti-inflammatory drugs are also blood thinners, and you don't want that. So he's basically just on liquid, you know, IVs. But he's getting better because you see these white patches, and then this is a girl over here. She started healing too. Those white patches are good because they tell us that the platelets are starting to plug up, the leaks in the capillaries, and you are turning the corner and you are starting to recover. Same thing here. If you look at this on the monitor, he's actually really purple. He's just starting to heal a little bit, painful, bleeding all over from head to toe. This is another young man. He was 20 years old. Red, looks like a sunburn all over. This isn't sunburn. See his arms, his hands? This is dengue hemorrhagic fever. So you have to walk a very precarious line with these people because we don't have enough platelets to transfuse patients. Platelets are the things that are going to plug up leaks in the capillaries. And I'll just give you an example. In January, we had 30,000, between January and February, 30,000 people with dengue fever that were hospitalized. 30,000. 600,000 people in the city. That would translate to Reno roughly having in 2 months somewhere around 45 or 50,000 cases of some kind of fever like that. Can you imagine the Purple Place, renowned, and St. Mary's trying to deal with 40,000 people who have dengue fever? Every physician, everybody, every nurse, you name it, everybody is on call. And they have to be out there. This kid was bleeding from his eyes. So it's a problem because you have so many people that are affected by this disorder. Now, they can recover, but many people die. This was taken, I took this after we got through with this big round of dengue patients because I always forget to bring my camera. And then I realized, oh, I should take a picture of this, and most of the patients were discharged. But just picture an auditorium big enough to play soccer in, as big as a basketball stadium, filled with beds, every bed filled with people who have dengue fever. And this is when they were emptying out. This is only one corner of that. Tuberculosis, you see a lot of tuberculosis there. These patients kind of waste away, very difficult. This is a dual infection, tuberculosis, HIV. And these patients go pretty quick. This patient had just tuberculosis. Tuberculosis you think of as lungs. This is a child that had cerebral tuberculosis. And this kid did not make it. That's why this kid's head is a little bigger, because he's got so much fluid on the brain. So tuberculosis does get into multi-organ system involvement, and it typically kills people with different organs. This is an X-ray of a young child, and Eddie, your laser pointer, it's hard to find that. And you see all these little white dots right here? Those are the tubercles. That's where the lungs are trying to wall off the organism that causes tuberculosis. This is a woman who had tuberculosis, and what you're seeing on an X-ray here is this is where your lungs are supposed to be. They're supposed to be black all the way through here. They are white because she's had tuberculosis for so long that everything is scarred over and those lungs don't function. She died 2 or 3 days after she came in. And you could look at that, and can you imagine breathing with that much damage to your lungs? So, it's a problem. Cerebral tuberculosis. You CT scan, and you see over here, look at all this. This is a hemorrhage. This is a cerebral hemorrhage due to tuberculosis. This is all blood and fluid filling in here. And look at how it's bulging and pushing over onto the other hemisphere. So not a good thing. Other viral infections, hepatitis B in a child. Now, Peru has a better vaccination program now than we do. This just happened to be a kid that was not vaccinated before the program started. Everybody in Peru is mandated to be vaccinated for Hep A, Hep B, and all the stuff we have, plus yellow fever and varicella zoster, which causes chickenpox. This is a man who was both alcoholic and had hepatitis B. This is his liver. He weighed 74 pounds. He died. This is a kid with herpes simplex, and people that think that, oh, these diseases, we have these vaccinations, you don't need them, these don't cause problems. Yes, they do. This kid had herpes simplex 1. This is clindamycin to take care of a secondary bacterial infection. But all of these areas right here that are very dark, those are dead tissue from the virus getting deep in there. He'll end up with scars. This is impetigo as a secondary infection. This is staphylococcus causing that. So in this case, we had 2 problems. He was on intravenous drugs. This is chickenpox. And people that think they want to put their kids through this, this girl, these are all from varicella zoster, the virus. These big, crusty, painful lesions are a secondary infection called impetigo from staph. And in her case, she had 2 bacteria, staph and strep. Shingles. Maybe you've heard of shingles. It is the secondary manifestation of chickenpox. So this is a 26-year-old male. These are all the blisters All of these are filled with millions of viral particles. Very painful to the touch because they are sitting on those subcutaneous nerve endings causing massive pain and inflammation. So we see other bacterial infections. Here's a kid with a staph infection. This is a diabetic who had cellulitis from staphylococcus. This is after she's recovering. This is necrotizing fasciitis. This is a guy that Persienga has taken off all his tissue on his legs because this is a strep infection that produces toxins that are just going to destroy your tissue quickly. And a lot of these people lead to amputation. This you see in the United States probably more than in Peru because we have more resistance to antibiotic drugs than they do in South America. Congenital syphilis. This is me and Moises taking care of a baby that was born with syphilis. This is a sexually transmitted disease called granuloma inguinale caused by a bacterium named Klebsiella. This patient, though, was dually infected with HIV. So this infection is going all the way through his body, and he died. So that kind of gives you an idea of the things that we treat. Let's go have a little fun. So we go to the jungle. This is one of my former students. Just teasing, just teasing. And, you know, we hop on a boat, pile all our stuff in there. We arrive at a lodge. This is off of another river called the Yanayacu River, which means the Black River in Quechua. We go to a lodge. We go to different lodges to stay different places. This is one of the doctors that I was working with in this particular clinic, me. This is my daughter. And, you know, you get to have some time in the lodge where you can just hang around, do nothing. And then you go out and see the jungle. Nice big tree here. These are the things that people are worried about with deforestation. And see how big they are? They're huge. Oh, everything's big. That's a bat. That's a tarantula. So imagine that. Okay, they're all big. Everything's big there. This is a tarantula that has been bitten by a wasp. This wasp is about 3 inches long. The tarantula, when fully, I was going to say inflated, but you know, not paralyzed, is about 10 inches across in diameter. But the wasp has bitten the tarantula, lays her eggs in there. And I have a video of this. I was walking through the jungle, and she's dragging the tarantula across the leafy material, and then lays the eggs in there. So while the tarantula is alive, they're going to develop the larvae in that tarantula. So we go to jungle clinics. Here's, you know, setting up a clinic. This is us going to another place. We take all of our gear, medical gear here, all of us. These are a couple of shots from a different clinic. Everybody gets to help kind of set up the pharmacy, and then you start working on people. This is a lady we had in January who was brought to us again, comatose, severely dehydrated, paralyzed, massive ulcers on the hips, both hips. We were able to stabilize her, get her to the hospital. She survived. She won't be able to walk. One of my friends, Dr. Kate, some of our students, things that hang in the jungle. So, you know, we do this. We go through these clinics and we help to treat people there and do good things, and then you go out and you can have fun. This is at a local dance club, which the Peruvians love their music 10 times louder than we do. Me juggling at the end of a clinic, and on this road right here, when we were coming off here, the day before us, there was an anaconda that was stretched across the entire path here, about 20 feet in length. And we just kind of walk around them, you know. Yeah, yeah. And then, you know, we can finish off with ají. These are called charapitas, which are peppers that are really, really spicy, but I love them. I eat them raw. And then some of the people that I work with in Peru, Van Adams, who is our CEO. This is a private organization that I work with. And then there's me, Persienga, Moises Siwincha, Dr. Heller, Carlos Clever, Dr. Liz Rios. And it's a pretty interesting thing. So that's sort of my story outside of the classroom of TMCC and the kinds of things that we do. It's a pretty cool job, I have to tell you, because you get to have fun. You do see a lot of terrible things. I spared you some of the other things that are pretty bad. But that's all I have to say. If you have any questions, we've got time for questions.
So the main reason for those three fevers is like pretty much humidity.
Well, if you look at malaria and you look at dengue, those two, the reason is mosquitoes. And, you know, yes, and they come up from water, humidity, all of that stuff. And there's just tremendous amounts of water. And the Amazon basin is huge. Only 4 to 6% of it has been mapped. And, you know, because I have students that they'll see slides like this, go, why don't they just spray? Say, really? So it's like saying, why don't you just spray all of Europe for mosquitoes? And then the thing is, they're going to come back in a week because there's no winter. Nothing, you know, Reno, that's what I mean. Reno is like, oh, you know, winter it gets, well, it used to get cold. This wasn't too bad. Well, I was gone part of it. I don't know if it was really that cold, but I came back at the end of January and people told me there was a couple of cold days or something, but there wasn't much snow. And everything dies, you know, mosquitoes die, and I don't know, we get 3 mosquitoes a week or something.
It's better to live in Reno if you want to, you know, stay away from those diseases.
Yeah, but, you know, but it really is an awesome place to live. I mean, it's beautiful. When I come back to Reno, I do get a little bit depressed because I fly in, and I used to do this 5 and 6 times a year. So I would be gone all the time. I'd come back, go back, you know, come back, go back. I was on sabbatical down there, and then now I go 2 and sometimes 3 times a year, but usually I go in the winter, go in the summer. I'll be back in August. And I come into Reno, and it's, you know, I look out the window, I'm like, it's brown. I mean, even when it's summer, it's like, that's it? That's it? No, it's totally brown. And then I, you know, and I live where I can drive across the Truckee River to see Eddie fishing. You know, I think, wow, that's a river? You know, that's sort of, we wouldn't even call, they wouldn't even name that.
What are some of the things you did to protect yourself?
Yeah, that's a really good question. Because I have had so many tourists bang on my door being sick and going, oh, you know, can you help us? Yes, but it's 2 in the morning. Why were you out in the jungle running around for a week in a tank top and shorts? Because you don't live there. If you live there, you're gonna live that way. If you're just visiting, the things that you do to protect yourself are, 1, you minimize exposure. That means that, you know, when we go to the jungle, because in my job down there, I can't get sick. You don't have that luxury. Because you can't wake up one day and go, ugh, you know, I just don't feel like doing this. I'm sick. You can't get sick. So you minimize the exposure, which means even if it's 110 degrees, you've got long sleeve shirts on, you have a shirt, you have jungle pants, boots, a hat, all those things. And then you get all the vaccinations that we have, everything that you can get vaccinated for. And then the third thing is we usually go on prophylactic treatment for malaria. Because I lived there for years, I don't worry about foodborne illness. But American tourists that come down, students who go down with me, have to go on some sort of prophylactic treatment, you know, preventative antibacterials or antibacterial medication for diarrhea, things like that, because that's really common for them. And you don't eat off the street. You know, in the market, you don't eat that stuff. If you buy something in the market, you cook it. And that's kind of how you prevent all those things. So you can't go down there and say, I'm never, ever going to get anything, but you certainly can reduce your chances. And so I had, you know, I've seen people down there that come. The funniest thing that happened to me, too, is this guy from South Africa, and he would go down every year, and he's well into his 50s, and he knocks on my door one night, like 3 in the morning. He's, you know, bloated. He's got all this. And so, well, do you have this? Do you have this? Yeah. Okay, you got Giardia. Giardia, you're from South Africa. What were you drinking? Oh, well, I'm on this butterfly exhibition. You know, expedition. Excuse me. Sometimes I mix my languages too. So, you know, so what are you doing? Well, we're cataloging these butterflies that are endangered, and we pack in. We go on horses, and we pack in all our water and all this kind of stuff. And I go, okay. Well, it was really hot. It hadn't rained in a few days, so we ran out of water. So, you know, we drank the water there. I go, do you have guides? He goes, yeah. So have you ever seen them drink water from any of these places? No. Why do you think that is? And well, I don't know. It's because they go and they find these big vines, and they cut the vine and they turn it upside down. They drink the purified water, and it's like, wow, this is the best water. They know the ones to drink. And I said, you know, you should just do what they're doing, or how about this? Why didn't you bring a water filter with you? And he goes, oh, that would have been a great idea. You know, seriously? I go, you don't have, I said, you are surrounded by water. You don't need to pack all your water in. Bring a filter. And he goes, oh, that's a, you know, next time we're down here, I think I'll do that. This guy's been here, you know, every year for 20 years. And he, you know, never thought of bringing a water filter. So I thought it was pretty interesting. So, any other questions?
How did you get involved with this? Or like, how did you start in agriculture?
Well, I've had a long and storied career of never planning anything and just sort of falling into, you know, my philosophy was just keep going, keep moving, get the degree, get the next degree, you know, make connections. But I had lived in Peru, you know, years before, and then I'd come back to the United States and, you know, went to school, got a bachelor's degree and a PhD, and went into research, came here to teach, and then through friends of friends of friends, you know, got a phone call one day, said, hey, you know, we're doing a project, could you come down and help us? I said, well, what do you need me for? Well, how many, you know, PhDs in virology that can translate in Spanish are there that you know? And I go, well, not too many. You know, what are we doing? Well, come down. So I ended up going down there and, you know, working with some people that I had known before, and then just, you know, one thing just kind of evolved into the next, where we set up an organization that takes students down, and you can email me or talk to me, anybody I know, if you want to go there, but we're only going to do this for one more year, and then we're shifting the focus of this company into other areas. So basically, you know, for me, it was building on, you know, networks, people that you knew before, and getting the right training, and you keep going through the degrees, and then opportunities present themselves to you. And I think for all of you in science, that's probably the best thing. And you can't go wrong with degrees in science. That's where the jobs are now. And as we continue to fall with fewer and fewer of our students wanting to go in science, you can't go wrong. You get your degrees in math and science, engineering, you will be employed. And even though I have a PhD in molecular biology, but I went back for clinical training in infectious disease in Iquitos years ago. But you know, the thing about it is, if you get the degrees, the money, the jobs will be there. And even, like I was saying, I have a PhD in molecular biology. And the unemployment rate for PhDs in biology, does anybody know what Nevada's unemployment rate is, by the way? 20%. Well, I mean, you know, listed, it's 8.5, the official. But the unemployment rate for PhDs in biology is 0.1%. 0.1. That means that 99.9% of us with a doctorate in biology have a job. If you get a degree, what are you guys going into?
Math.
In math? Engineering, math, science, computers, I mean, you know. What about you guys?
Math and computers.
Math and computers. Chris, you're going into nursing, right?
No.
Or, I'm sorry.
Science and math.
Science and math. How about, are you a student or?
I'm not a student, but I did get a science degree.
Yeah. And you got a job?
I'm employed, yeah.
Yeah, there you go. How about you? Biochemistry. Tons of jobs. What about you?
Math, computer science.
Math. Kaylee, you figured out? Biology? Mechanical engineering. See, you guys will have jobs. You'll be the people that said, you know, even though you hear that, oh, science is hard, and those of us that teach, oh, you're giving us so much information.
The only thing
You
you can do
know.
with math is teach at high school.
You know, if you take a math degree and you move it into any of the chemical engineering, civil engineering, any of those kinds of things, computers, I mean, that's like a gateway degree. If you plan on just getting a bachelor's in math, I would agree with you. But if you move on and you say, I got a math degree, I'm going for a master's in engineering, you are going to get snatched up before you can defend your thesis. You will.
Somebody would come to rescue me before I defend myself.
And you ladies, I have a daughter who is graduating from here this semester, and she's going to UN-R, and she's torn between, you know, she's really a good student, and she's torn between, do I want to get my degree in engineering or do I want to go to law school? And as soon as she starts talking to people she knows that are engineers, they're like, you'll be a senior, and they will be beating down your door because you're female and you got a degree in engineering, and they're looking for you. And she's going, wow, you know, versus you go to law school and you have another 3 or 4 years to go, and then you have to kind of go out and make your way, right? Because we have a lot of lawyers, so there's a lot of competition. But, you know, keep that in mind. Anything else? Any other comments, questions? All right. Well, thank you. Thank you for inviting me. I hope you learned something.